Good afternoon. My name is Deborah Nicolo. I'm a DNP student at Capella, and this is an interview with Taylor Bird for interviewing her. She is a nurse practitioner for the last 6 years. So without further ado, we're here in the beautiful state of Florida. I'm going to start the interview with Taylor. Taylor, would you like to say hello to the audience?
Hello everyone, my name's Taylor. I'm here to do an interview with Deb, talk a little bit about my experience as a nurse practitioner over the last 6 years.
All right. And so let's get in gear. Let's get ready. Taylor, could you walk me through your experience as a nurse practitioner, particularly in your primary care setting?
Sure. So I've been practicing as a nurse practitioner, a family nurse practitioner, for the last 6 years. 4 of those years I focused primarily on primary care at the Metropolitan Health Partners. Here in this role, I managed a panel of approximately 1,200 patients ranging from pediatric to geriatric care. My responsibilities included conducting comprehensive health assessments, managing chronic conditions like diabetes and hypertension, and then also providing preventative care services. I've developed particular expertise in chronic disease management because this is primarily what I do. Having implemented a successful diabetes management program, studies have shown in this program that I did that A1C levels were reduced by an average of 1.2% among our high-risk patients, which is great. Additionally, I served as the lead for our clinic's preventative care initiative, and this is where I helped increase screening rates for breast and colorectal cancer by 25% over the past 2 years.
Wow, that's great. That's great. So could you also describe a challenging clinical case that you've managed and how you approached it?
Sure. So one that sticks out to me particularly is a recent complex case involving a 67-year-old patient with poorly controlled type 2 diabetes. These are patients that we see frequently in the clinic. Also had chronic kidney disease and was newly diagnosed with depression. The challenge wasn't just medically managing his chronic condition, but also addressing the social determinants that affected this patient's care. First, I approached this by doing a comprehensive health assessment, as we do for all of our patients, including his social and environmental factors. I discovered that transportation was an issue, wasn't able to make it to their follow-up appointments and things like that, which could cause all of these issues to arise. The patient also was having food insecurity, and also they were just not really compliant with their medications. I was able to collaborate with some of our social workers to arrange transportation to help this patient get to and from their appointments, and also connect with some resources in the community that could help this patient in regards to their meals. Also implemented a simple medication regimen that the patient would be able to easily understand and follow to ensure that this patient would be compliant with their medication. Also, after all of these things were set up for the patients, I was able to set up telehealth check-ins between office visits to make sure that the patient was getting to their appointments, the transportation was working out, and that the resources to help with the meals and all of that was going well. Within 3 months after seeing and treating this patient, in the clinic we saw that their A1C decreased from 9.8 to 7.6. So obviously there that shows that the resources and all the things that we provided for this patient were working. The patient said that their depression symptoms had improved, which is great. And this patient's medication compliance increased to 90%. I think all of the things that we did to set this patient up for success worked. This particular case highlighted the importance of addressing this patient's medical and social aspects, which takes care of the patient as a whole.
Oh, that's great. So with that, how do you approach collaboration with physicians, specialists, and other healthcare team members?
So I believe in effective collaboration is built on clear communication amongst that and for all other things in life. Mutual respect is the big one, and shared commitment to ensuring that we are actually caring for and treating these patients. That's going to ensure that the patient outcomes are the best. In my current role, I've established a structured approach to collaboration, and I'll kind of go through my approach. First, I make sure that I maintain regular communication channels with all of my patients through formal and informal means. For example, the situation in the case that I talked about briefly earlier, in between office visits, I was able to do telehealth visits with this patient, so that kind of helped keep everything on track. Having weekly meeting huddles with the team to make sure that we're discussing our complex cases and coordinating care plans, making sure everyone's on the same page. I also did initiate a monthly case review session where everyone sits down, we have a meeting, we go over the challenging cases as a team and see how we can handle that. If I'm consulting with a specialist, I ensure that all relevant information is provided up front and make sure to maintain direct communication for urgent issues. That way we can get those figured out first. For example, I started a standardized referral templates to help kind of keep all of this in track, including key clinical information, running back and forth communication, and improving care coordination for everyone to make sure everyone's on the same page. Additionally to all of these things, I try to participate in the interdisciplinary care meetings, where I often serve as a bridge between the nursing staff and the physicians to make sure, again, we're all on the same page to help ensure all of these patients are getting the best care.
That's great. So what strategies do you use to ensure patient compliance and treatment plans, particularly in complex cases?
There are several strategies I use to do this. So first, I use the teach-back method, which, if you remember back to nursing school, that was the basis for everything. I think that works best. I also created simplified written instructions with visual aids because a lot of people are visual learners. Using motivational interviewing techniques to understand the barriers that these patients have to compliance. Again, we'll circle back to the situation I had with that patient earlier, from understanding their social and health aspects. All of that ties in together. So making sure you know all of their barriers so that we can fix all aspects. Involve family members, because sometimes family members are, your number one go-to for information for patients if they're not able to tell us themselves. Utilizing the patient portal for ongoing communication. I think that's very helpful that patients can see what's going on with them. That way everyone's on the same page. And scheduling regular check-ins, and again, in between times doing the telehealth visits when you're in between office visits definitely helps. For example, I had a complex cardiac patient. I created a color-coded medication schedule because they did have to take so many medications. Connected them to the pharmacy's medication packaging service so that they could see this medication was this color and so on and so forth. We also used their smartphone and put in reminders, and also involved their spouse, who was able to help with the reminders and make sure the patient was getting their medication, the right medication at the right time. This approach improved this particular patient's medication compliance from 60 to 95%, which was great.
Yeah, that's beautiful. So how do you approach cultural competency in your practice?
So cultural competency is a huge part of what we do. There are multiple steps to my approach. Obviously, continuous education. I do competencies and cultural training to stay updated on health beliefs and practices for all the diverse patient population that we see. Individual assessment. I take time to sit and talk to the patients and make sure I really understand their culture, their background, and all of the beliefs and all of that goes into it with their health. Also, for language access, obviously there are multiple different languages that we come in contact with. I ensure that we have proper interpretive services in our facility and make sure that they're up to date and working at all times. And then just being flexible with care plans depending on the type of needs that they need with their specific culture and background. For an example, during Ramadan, I did have a Muslim patient in the office that had to have medication adjustments and monitoring their plans while maintaining, this disease management. I was able to, focus on their outcomes in their community.
Wow. So the experience that you have with EHR technology experience is what? Because obviously with telehealth, and now I think most practices are going for telehealth, especially in the rural communities. So what type of extensive experience do you have with the EHR system, including Epic and Cerner?
Sure. I mean, after however many years I've been doing this, we've used all and any different kind of EHR systems. I do have a lot of experience with Epic and Cerner. In my current role, I'm actually an Epic super user, and I did previously use Cerner. I'm proficient in the clinical documentation aspect for both of these charting systems. Also for order entry and management, population health analytics, patient portal communication, and then quality metrics tracking. I've also participated in committees that optimize the EHR, where we've developed templates and order sets that improve efficiency while maintaining the quality of our documentation as well. The quality metrics and population health management, I have been using this for our clinic's diabetes management program, which allows regular analysis of patient outcomes, the data for that, and then implementing evidence-based protocols, coordinating with our quality team on metrics reporting, tracking preventative care metrics, managing the chronic disease outcomes, implementing the care gap analysis, and then also we've developed some outreach programs for high risk patients, and then we've also implemented some screening protocols and managed some care coordination programs. These have all helped our facility exceed quality benchmarks in all of these key areas.
That's great. So as we're ending our interview, Taylor, I just want to ask, can you just let our audience know, when you first became a nurse practitioner, what was it that made it an easy transition for you going from bedside nursing to becoming the nurse practitioner that you are today?
Well, that's a great question. I think that all of the clinical skills and spending as much time as you do at the bedside was amazing for becoming a nurse practitioner. The roles are completely different and you do many different things. But I think having multiple years experience as a bedside nurse really paves the way for you to be a good nurse practitioner. It makes you want to spend more time with your patient and really get to know everything, again, from like their social to environmental to their health, all aspects of their life, so that you can care for the whole patient.
And when meeting the patient, different from bedside, as a nurse practitioner, when meeting them, do you feel like you're asking them different questions upon the assessment of seeing them than you did as a bedside nurse?
Yeah, I think the role, like I said, is a little different in that aspect. I think as a nurse practitioner, you have to dive deeper. You have to kind of get down to the root cause of what's causing all of these chronic issues. Sometimes as bedside nurses, we're really just kind of following doctor's orders and doing things just to give meds for these diseases, for symptom management. But I feel as a nurse practitioner, you're really diving down deep into the patient's history and all the things that are going on with them, and you can kind of find the root cause to maybe heal all of these things from the inside out.
All right, Taylor. Well, it was a joy interviewing you and an inspiration.
Thank you.
I am looking forward to working with you in the future.
Absolutely.
And finishing this DNP program. And I too am also a few months away from the nurse practitioner, so I
That's
hope
so
we're going to be.
exciting.
It is very exciting.
That's awesome.
We're all going to be practicing clinicians.
Yes, absolutely.
Thank you. So this is Taylor Bird and Deborah Nicolo signing off. Thank you.
Thank you.